Okay, now we're moving on to gastrointestinal disorders. This should be fun. This is just showing what the major organs of the gastrointestinal tract are and the structures and muscles of the abdominal cavity. The organs in the GI tract are the liver, gallbladder, pancreas, spleen, and kidney. These are essential organs for digestion and absorbing nutrients for the GI system, through the GI system. So when we talk about the abdomen, clinicians will typically divide it into four quadrants. And oftentimes when you're doing an evaluation of the GI tract, they will want you to identify, or you will identify, what quadrant the pain is in, because that helps the healthcare provider to be able to identify which organs may be involved. So you have the right upper quadrant, the left upper quadrant, right lower quadrant, and left lower quadrant. The midline, the dividing midline, extends from the center of the sternum through the pubic bone, and then the horizontal line extends through the umbilicus, and that's what separates each of the quadrants. In the right upper quadrant, these are the organs: the liver, the gallbladder, the duodenum, head of the pancreas, right adrenal gland, portion of the right kidney, and portions of the ascending and transverse colon. You would not have to, for a final exam, be able to identify which quadrant the specific organs are in. I wouldn't have you do that. Left upper is the left lobe of the liver, the spleen, the stomach, the body of the pancreas, the left adrenal gland, portion of the left kidney, and portion of the ascending and transverse colon. Right lower quadrant, you can read what they are. And left lower quadrant, you can read what they are. When you're evaluating a person for abdominal pain, the problem may not be, if a person has abdominal pain, it doesn't mean that the problem is within the gastrointestinal tract. A lot of the conditions of the heart, the lungs, the kidneys, the musculoskeletal system can present as abdominal pain. So it's important to be able to identify where the pain is and what is the quality of the pain and does it radiate, etc. So you always have to consider differential diagnosis if a person has complaints of abdominal pain. In doing an exam history, you want to look at the pain. When did it start? How long has it lasted? How severe is it? What type of pain is it? As I said, does it radiate anywhere else? Are there any associated symptoms like nausea, vomiting, diarrhea, constipation? Is there anything that makes it better or worse? Have any medications been taken, or are they on any medications? How do they do with eating? So is it bothered? Some GI conditions are exacerbated by the presence of food, and sometimes some of them feel better with certain types of food. So you want to be able to identify some of those things. You could also see changes in appetite. So that's important to know. Have they been more hungry? Have they been less hungry? And what are their bowel habits? Has anything changed in terms of frequency, quality, color of the bowel movements? So looking first at the condition of nausea, vomiting, and diarrhea. Generally, that's going to be managed with over-the-counter medicines. We've all experienced these things at some point in our life for various reasons. Sometimes they can be signs of more serious condition. You want to look at some of the other factors as well. You have to look at, or at least be able to find out what is the character of the material, whether vomited or stool. So again, that goes to the color, the quality, the consistency of whatever, whether it was the vomit or the stool. If symptoms have been present for more than 24 to 36 hours, or there's significant pain or fever, then it's important for a person to be able to go see a physician. There could be some serious issues with dehydration, or it could be related to another more serious condition. Viral gastroenteritis is a condition that's an intestinal infection that's marked by watery diarrhea, abdominal cramps, nausea, vomiting, sometimes associated with fever. The most common way to get a viral gastroenteritis, which we often refer to as the stomach flu, is through contact with an infected person or by ingesting contaminated food or water. Gastroenteritis is an inflammation of the lining of the stomach and small and large intestines. Typically, people have the diarrhea, nausea, vomiting, and abdominal pain. Diagnosis is made based on the history and recent contact with contaminated food or contaminated people. Washing hands after bowel movement or in contact with fecal matter, avoiding undercooked foods. Those are the best ways to prevent getting gastroenteritis. Sometimes it's accompanied with a loss of appetite, cramps, and discomfort. Usually not serious in a healthy adult, causes some discomfort and inconvenience, but it can cause a life threatening dehydration and an imbalance of electrolytes in people who are ill or weak, people who are very young or very old. Food poisoning is something else that's a disorder of the GI tract. Should be suspected when there are multiple people who ate the same food who became ill at about the same time. You could also have people who ate the same food who don't get ill at the same time. My mother and father both ate off contaminated chicken. My mother got very ill from food poisoning. My father didn't get anything. I took a group of students to Africa. I think I told you guys about going, but I'm not sure I mentioned that 13 of the 16 people got food poisoning because they were cooking. The village women who were taking care of us were cooking our lunch and dinner at the same time. So dinner would sit out in 100-degree heat from the time that they cooked lunch. So there were some issues there. So I personally didn't get the food poisoning, although I ate the same food as the 13 people who did get it. So food poisoning is often as a result of food being improperly handled, cooked, stored, or refrigerated. So it could be the bacteria, or it could be toxins produced by the bacteria that make a person sick. So we are familiar generally with salmonella, that's a food poisoning, but staphylococcus species can also be associated with food poisoning. Parasitic infections are a little less common than the bacterial or viral infections. Giardia is one that's a waterborne protozoan. It's found worldwide. Giardia is a diarrheal disease and caused by a microscopic parasite. And so when we think of a parasite is an organism that feeds off another to survive. So once a person or animal has been infected with Giardia, the parasite lives in the intestines and is passed on in feces. Once it's outside the body, the Giardia can sometimes survive for weeks or even months, and it's found all around the world, and including in the United States. It's usually diagnosed in the United States and among travelers with chronic diarrhea. So it's more common for people who have traveled outside the United States, but they're bringing it back into the United States. Symptoms can vary and can last from 1 to 2 weeks. In some cases, people with Giardia have no symptoms whatsoever. Some of the acute symptoms that you see with Giardia are diarrhea, gas, greasy stool that tend to float, abdominal or stomach cramps, nausea, vomiting, dehydration. You can also get itchy skin, hives, and swelling of the eyes. One of the things, Giardia can be difficult to treat. And it can seem like it's gone away only to come back after several days or weeks. And it can cause the person with it to lose weight, have difficulty absorbing fat. They can develop difficulty being able to absorb lactose and certain vitamins as well. Generally treated with medications. Entamoeba, and I'm not quite sure how to say that, is another parasite that can affect humans and other primates. So the active stage exists only in the host and in fresh, loose feces. So the cysts survive outside the host in water and soils, on food, in moist conditions. And the infection can occur when a person puts anything in their mouth that has touched the feces of a person who's infected. So it sounds disgusting and like how you would ever do that, but if you have a person who is a chef in a restaurant who doesn't thoroughly wash their hands and they have this, it can get passed. So it's easier to pass than it sounds like. So these cysts that are in the feces are readily killed by heat and freezing temperatures. So it's important to remember to thoroughly cook food. That's important when it comes to this particular infection. The primary result of which, primary cause of which, is unsanitary conditions. This also tends to be treated with medication. Stress can also cause a variety of gastrointestinal systems. The gut is really vulnerable to the presence of chronic and even acute stress and can cause stress-induced changes in gastric secretion, the ability of the gut to move, so gut motility, and then really mucosal blood flow. So all of that can be affected by stress, which can cause problems with the gastrointestinal tract. So chronic exposure to stress can lead to a variety of GI diseases like gastroesophageal reflux disease, or GERD, that we're going to talk about soon, peptic ulcers, irritable bowel syndrome, and even food allergies. There have been a lot of studies done, and the studies have shown that psychological stress slows the movement of food or waste through the small intestines and can encourage the overgrowth of bacteria. So in that way, chronic stress plays an important role in the development of that small intestine bacterial overgrowth and leaky gut syndrome. So you wouldn't think stress would necessarily play a significant role in GI tract conditions, but it does, because it affects all of these areas. So moving on to heartburn and GERD. Heartburn and esophageal reflux are used interchangeably. GERD occurs when the stomach acid flows back into the esophagus, and that backwash or acid reflux irritates the lining of the esophagus. So people experience acid reflux from time to time. Everybody experiences it from time to time. GERD is a mild acid reflux that occurs at least twice a week, or moderate to severe acid reflux that occurs at least once a week. So there is a diagnostic criteria. Most people can manage the discomfort of GERD with lifestyle changes and over-the-counter medications, but sometimes people need some stronger medications to ease the symptoms, such as that burning sensation in the chest, usually after eating, sometimes worse at night, difficulty swallowing, chest pain, regurgitation of food or feeling like it's a sour liquid, sensation of having a lump in your throat, chronic cough, laryngitis. GERD is caused by frequent acid reflux. When you swallow, the lower esophageal sphincter relaxes to allow food and liquid to flow into your stomach, and then it closes again. But if it weakens or doesn't work correctly, that stomach acid can flow back up into your esophagus. And this backwash irritates the lining of your esophagus and can become inflamed. So complications, you can cause a narrowing of the esophagus. You can develop an open sore in the esophagus. You can have precancerous changes to the esophagus. So GERD is something that really should be treated. You don't want to have that continual acid in your esophagus.